welcome again to your own YouTube channel, Ask Your Gynaecologist. I am Dr. Sonal Parihar. As usual, I have come back with a new topic for you all. Last time we discussed polyhydramnios, that is when the liquor, the fluid inside the uterus around the baby is more than 14, right? So that is polyhydramnios, and we discussed the causes, the symptoms and the remedies of polyhydramnios. This time in continuation we will be discussing about oligohydramnios. That means when the fluid inside the uterus around the baby in the womb in a pregnant lady is less than 10, when the AFI is 10 or less, right? So we'll be discussing severe oligohydramnios, we'll be discussing the causes, the remedies, the symptoms and other things, right? So before I continue, I would just like to tell you the DocWise app has picked up very well. Every day so many patients are connected with me, patients sitting in India, patients sitting abroad. We can communicate with each other through messages like WhatsApp. We can send voice messages to each other. I can give you a call if you are in India, and then I can easily give you prescriptions, right? So this is an application which can be easily downloaded on your mobile's Play Store, and then you have to put my pin, insert my pin, and then you get connected with me directly. Okay, apart from this, if you want to connect with me directly, then there is another option. I go live almost every day on this channel. So in the live chat, I answer your questions which you have asked a day before. I do not do the live chatting because it is just not possible. There are so many questions. So if you want me to answer your personal question there and then, you don't want to wait for the next day, you can just use Super Chat. Right? Super Chat, as soon as you click on it, it will tell you how much you have to deposit. It starts with 40 Indian rupees, and then depending upon the length of the question, as soon as you type your question, the question will flash on my screen and I will answer the question there and then. Okay? Now, the two advantages of Super Chat are, first of all, you get your answer there and then, you don't need to wait for the next day. Secondly, you can easily ask personal questions, right? The only thing is I cannot give you prescription when I go live. Right? It is not allowed to give you prescription or to talk about medicines in the live show. So if at all you have a personal question, you should use Super Chat, okay? Because I do not answer the personal questions in the live chat, because as you know, it is not possible to basically go through all the personal questions. I just select the general questions, and that is what I do in the live chat, so that you and other public, there are other people who are listening to it, they can benefit from it. Okay. Apart from this, I have got other portals, Facebook pages, Instagram, Twitter. Please do not post your questions there. You can follow me there because I am a public figure. You can follow me there. But please type your questions, the medical related questions, on the YouTube itself. Okay. So coming back to the topic, oligohydramnios. Oligohydramnios, as the word indicates, the English word, oligo means less. So we discussed in the last video the normal amniotic fluid index, which is the sum total of all the four quadrants. We measure the pockets of fluid inside the mother's tummy, and then we calculate it in centimeters. It should be between 10 to 14. If it is less than 10, it is oligohydramnios. If it is less than 7, it is moderate oligohydramnios. If it is less than 5, it becomes severe oligohydramnios, and that needs delivery. Okay, but that doesn't mean that as soon as you have an AFI of 5, you should go running and, oh, please deliver me, or the doctor will deliver you. It depends upon many other circumstances like your gestational age, the baby's weight, and your condition, the medical condition. There are so many other things. Okay, now coming to the causes. Why does this happen? Well, as I told you in the last video, the fluid is formed by the placenta. The placenta, it manufactures the fluid which contains all the nutrients, the vitamins, the minerals that the baby needs. It surrounds the baby like a cushion. It protects the baby from the outer world. It is like a cushion, a tension bearing cushion. So even if somebody hits on the mother's tummy, there is a bag of cushion around, that is the fluid which protects the baby, right? So there are so many advantages of this fluid. So when the fluid decreases, the baby's growth obviously decreases. So first factor, or the first cause of oligohydramnios will be less manufacturing by the placenta. That means there is placental insufficiency. That means the placenta is either small, or it is not getting, it has not formed properly. It does not have that property of giving a healthy liquid and a healthy pregnancy to the baby, right? So placental defects, placental insufficiency. Now this can happen in any kind of cases where the mother's health is not good. Like for example, preeclampsia, PIH, high blood pressure, whenever there is problem in the capillary distribution in the blood vessels of the mother, because the blood vessels, they basically supply the blood and the nutrients to the baby through the placenta. So whenever there is a vascular disease, or there is PIH, which I have already discussed in one of our videos, why blood pressure increases during pregnancy, that is PIH. All these conditions and other chronic systemic diseases like heart disease or lung disease or kidney disease, if the mother is suffering from all these, then there will be placental insufficiency. Okay. Second cause, the major cause, is obviously when there is a leak in the amniotic membrane. Now it can be a high leak or a fore leak. Now don't go into the details of that. Wherever there is a rupture of membranes, if it ruptures in the four membranes means the membranes which are just in front of the baby's head, that is just down, just near the internal os. If that ruptures, that is definitely PPROM, that is premature rupture of membranes, which I have already discussed in one of my videos. That was around 3 months ago. We discussed why does this happen, why does premature rupture of membranes happens, why does preterm delivery happen. So I have discussed all the causes there. So this is one of the major causes of oligohydramnios, when there is a leak. Now, as I said, fore leak or hind leak. Hind leak means behind the baby. The baby is like this, right? Now this is the vaginal cavity, this is the cervix from where the baby has to come out. So if it leaks here, if it ruptures here, right in front of the baby's head, that is called fore leak. And if it ruptures right behind the baby, somewhere inside the uterus, that is hind leak. Hind leak is not that dangerous because it gets sealed itself. Fore leak is dangerous because once it ruptures, it is like a balloon rupturing. We cannot seal it back. Right? And then the protective environment, the cushion which separates the baby from the surrounding world, it is gone. So that is dangerous for the baby, and that needs delivery. Now, many people ask me how many days should we wait if you are already term or near term, say more than 33-34 weeks, and your membranes have ruptured. Normally, we expect that you will go into labor within 24 hours. If you do not go into labor, then the doctor will have to induce you. We might just wait for 1 or 2 days so that the baby gets mature enough. We give them some injections for the lung maturity like betamethasone, steroid injections. As soon as that time is covered, that 48 hours is gone, and we think that the baby is now good enough to deliver, because we cannot keep the baby for long. Right? So premature rupture of membranes, depending upon the gestational age, the baby's weight, we decide it needs delivery. We cannot keep the baby in with the leaking fluid. Okay? So first cause, placental insufficiency. Secondly, rupture of membranes. Third cause is obviously baby. We discussed in the last video how the cycle of the fluid is maintained. The placenta manufactures it, the baby drinks it, and then the baby removes the excess fluid through urine. So basically it is reducing and it is again forming the fluid, right? So when there is problem in the drinking part, then it becomes polyhydramnios. We have discussed that in the last video. But if there is problem in urination, when the baby is not able to pass urine, then obviously the amniotic fluid will decrease, because this is how it gets replenished through the baby. Okay. Now, as I discussed in the last video, posterior urethral valve is one of the conditions which can be diagnosed in the ultrasound, and it is common in male babies. So we can see during ultrasound that the bladder is not getting empty. So this is something which can be remedied later once the baby is born, if at all it was diagnosed antenatally. Okay. So these are the three major causes, and the fourth cause is, as I said, in polyhydramnios, we don't know, idiopathic. Sometimes there are just no causes, but generally when we cannot find any cause in oligohydramnios, it has to be blamed. The placenta has to be blamed. It is placental insufficiency always. Okay. Now, what are the symptoms? Well, in the mother, obviously the tummy will be small. She comes for an examination. The ultrasoundologist will tell her that the fluid is less. The fetal heartbeat, the baby's heartbeat might be irregular because it is not getting enough nutrients. It might not be happy inside, so that might give the irregular heartbeat, and a not very good CTG, the cardiotocography, the NST tests that we do, they will not come very nice. Okay. Then coming to the baby symptoms. Now, baby obviously will not be happy. First of all, it will be growth retarded. Growth retarded because there is not enough fluid, not enough nutrients, so the growth of the baby will be stunted. Secondly, because of lack of fluid, the lungs of the baby will not develop, especially if the fluid is less from the very beginning, say around 16-20 weeks, 20-22 weeks. That is the time when the baby starts growing up, right? By 5th month, by 20 weeks, the baby is completely formed. All the organs are completely formed. That is why we do an anomaly scan, a detailed scan at 20 weeks to check that all the organs have formed completely. There is no defect. Now, this is the time when the lungs are developing and they are increasing their weight along with the baby. So, if the fluid is less at this particular age and it continues like that, the pulmonary hypoplasia happens. Means the lungs do not develop properly, and such baby is very difficult to survive. Either they die inside the uterus or they die outside. Okay. Now, the other things is if at all there is so much less fluid from say 3-4 months long-standing oligohydramnios, then the limbs, the upper limb, the lower limbs, they might get captured in amniotic bands. They might become valgus or varus. These are the various deformities of the skeletal deformities might happen. What else can happen when the fluid is less? Well, the baby's limbs, the hands and the feet, they get kind of malformed because there is no space for the baby to kind of spread its legs, spread its hands. So there may be skeletal deformities in the form of equinovalgus, varus, like the hands can be like this, the feet can be turned inside or turned outside. So these are skeletal deformities which happen because of less fluid, because the baby doesn't have place to spread its legs or its hands and the limbs and all, right? Now, there may be cord entrapment as well. The cord, the umbilical cord, which supplies the blood and all the nutrients through the placenta to the baby, that gets trapped because of less fluid. It might get compressed by the baby itself. It might get trapped between the two uterine walls, and that is very dangerous because if the blood supply to the baby is cut off, it might die inside. Such babies are weak, as I told you, they are growth restricted, they are stunted, so they do not have the capacity to tolerate the pains. When the patient goes into labor, the uterus kind of contracts and it compresses the baby's head. The baby gets compressed because the cushion effect of the fluid is not there. So such babies are generally born by cesarean because we do not want to give them more stress. They are already stressed when they are inside the uterus, right? So these are the symptoms of the mother and the baby. Now, what is the remedy? Well, first of all, treat the cause. Treat the cause because whatever the cause is, the mother is suffering from some disease, the mother is having PIH, high blood pressure, whatever is the cause that has been detected, treat that. If it's the baby who's responsible, then yes, the baby will be operated once it comes out if it has any operable condition, if it's suffering from some operable condition. Otherwise, the medicines or the IV fluids which are available in the market, they all contain amino acids, mainly arginine, vasopressin. These are the combinations which are available in the market, and they are supposed to stimulate the placenta to secrete more fluid. So they can be given in the form of IV fluids, they can be given in the form of sachets like powders to be dissolved in water and drink it, or in the form of tablets. It depends from patient to patient, depends upon the compliance, depends upon the problem the patient is suffering from, how much oligohydramnios she is having, right? So these are the treatments that we normally give. Sometimes we do ask the patient to drink a lot of fluid because too much fluid, if she drinks, then obviously if she is hydrated, then this particular hydration will go inside the uterus as well. So whenever the tissues of anybody is dehydrated, we ask them to drink more water. Although it has no direct connection with the uterus, when she drinks fluid, it does not go inside the uterus, but it is just a way of hydrating the body. Okay. Now, there were certain things which were used in the previous years, but now we don't do it. Like, for example, initially we used to put a needle inside the uterus and infuse the amniotic fluid, infuse some ringer lactate or isotonic fluids which match with the body fluids. But now we don't do it. As I told you in the previous video, polyhydramnios, in which we used to drain out the fluid. Now we don't do it because there's a risk of infection as well as abortion. So these things are not done anymore, right? So these are the causes, these are the symptoms, the results of oligohydramnios and the treatment, right? So this is all you need to know about oligohydramnios. In case you have any question, you can always post it on my channels, Dr. Sonal's Answers, or any video. You can pick up any video on Ask Your Gynecologist. You can put your questions on the live session, and then if they are general questions, I will answer that, right? So take care, please. Click the like button if you like the video, subscribe to the channel and share the video. Thank you very much.